My name is Julia Massi, and I'm a senior majoring in health behavior science and minoring in public health, global health, and statistical data analytics. I worked with Dr. Jennifer Horney to conduct a research project on public health impacts of climate change during compound disasters. Our research focused on the need for stronger worldwide adaptation measures that will limit future impacts. A compound, cascading, or complex disaster means that individuals and communities are more frequently experiencing multiple catastrophes at once. The goal of climate adaptation is to minimize the impacts of a disaster by becoming more climate resilient. Without adequate measures, climate can act as a crisis multiplier. For example, extreme heat in the western U.S. led to droughts and wildfires, which caused a series of public health disasters. Western wildfires caused residents to evacuate at congregate shelters, causing COVID outbreaks and an overload of the local healthcare system. Smoke from wildfires can make you more susceptible to long-term respiratory infections, like COVID, not to mention the long-term effects on a weakened immune system caused by post-disaster stress. Extreme heat in the West is just one example that illustrates how one disaster can lead to a cascading crisis. Our research emphasized the need to quantify the long-term effects on health rather than focusing primarily on the short-term impacts. Geographically, there has been a variety of success in adaptation efforts worldwide. Only half of countries have a plan to combat climate change or the data to support the development of plans. Shown in Figure 1, the BRACE framework is a 5-stage model guided by the CDC that is used as an adaptation strategy in the U.S. Our research project utilized BRACE as a starting point for understanding how climate change interacts with compound disasters to impact health outcomes such as food and water security, physical and mental health, and equitable access to healthcare. Using our research findings, we designed a 4-stage complex adaptation plan that can be tailored to each community's individual needs. First, there needs to be a clear understanding of how climate change influences long-term health outcomes in order to perceive risks accurately. Second, it's important to assess vulnerability to prioritize regions most susceptible to a specific harm. For example, the Pacific Islands may center adaptation measures around the high likelihood of a tropical hurricane, like building infrastructure adapted to flooding. The third component is stronger collaboration between levels of government and health professionals so that economics, public health initiatives, and climate science are in solidarity with policymakers. Systemic planning within each domestic border will promote global partnership, the final step towards global climate resilience. It is important to note that the U.S. is a top contributor to carbon emissions and highly responsible for the speed of climate change, and unfairly is still one of the most climate resilient countries due to the availability of our wealth and resources. Despite being one of the most climate resilient countries, communities still feel the impacts of climate change. Shown in the right bottom corner, we used Arizona Heat Week as an example of a successful adaptation measure. In response to the rising incidence of heat-related illness, the intervention spread awareness on risk statistics, provided doctor-recommended prevention measures, and home remedy steps for heat-related illness. The campaign was successful because it was tailored to the vulnerability of heat in Arizona and provided a platform for louder voices of health professionals. In summary, the impacts of more frequent, severe, complex, cascading disasters and public health emergencies will continue to rapidly exacerbate concurrent with the rising global temperature extremes. The faster the climate changes, the harder it will be to adapt. The potential impacts from the concurrent disasters illustrate the urgent need for climate adaptation, as well as more research on the long-term outcomes. The future direction of our research will be included as a publication in the Oxford Encyclopedia of Water Resources Management and Policy.